Good morning, everyone. Welcome and thank you for joining us. I'm Cassandra Williamson-Hopp, the Conference Editor of Benefits Canada, and your host for today's webinar. With the impact of the coronavirus being felt across the globe, Canadian employers and employees are facing both personal and professional pressures. While physical well-being is vital at this time, the pandemic is raising multiple mental health issues as well, including rising stress levels exacerbated by job uncertainty and social isolation. Looking at mental health policies and tools, innovative practices, and work-from-home protocols, what do employers need to know in order to manage these strange and uncertain times, particularly as it pertains to supporting the psychological health of plan members? This morning's webinar will address just that. Just a few housekeeping notes before we get started. This is an example of an attendee interface. You should see something similar on your own computer desktop in the upper right-hand corner. Please use the orange arrow to open and close your control panel and the audio tab to select your preferred audio, either mic and speakers to use your computer audio or telephone to dial in using the information provided. If you have any questions for today's presenters, please type them into the questions pane of the control panel. You can send in your inquiries at any time. We'll be collecting these and addressing them during the audience Q&A session at the end of today's webinar. To begin, let me introduce you to our experts. Claire Duboc is MindBeacon Group's Managing Director. Nigel Branker is Executive Vice President and President of Health and Productivity Solutions at Morneau Shepell. Karen Adams is Snapclarity's Chief Commercial and Health Innovation Officer. And Lori Casselman is President and Chief Revenue Officer of Wello. I want to open up with a couple general questions for everyone, because even before the coronavirus crisis, one of the downsides of remote working that's constantly brought up is its effect on people's mental health. How can employers introduce robust policies to ensure employees stay engaged and mentally healthy at this time? Claire, let's start with you.
Thanks, Cassandra. I think that's a great question. And what I would say is that in the past, for many, the chance to work remotely offered lots of benefits. People had access to job opportunities they might not have had otherwise. And for some, this approach allowed them to just be more productive. And as long as organizations and managers were super clear about setting the expectations on deliverables and making sure they were doing things like holding regular virtual meetings to keep lines of communications open, it worked. But I think what we found with COVID-19 is that for those of us who aren't frontline workers and being forced to be out there in the world, we're being forced to work remotely. And this is a big change, and it happened very, very quickly. And for most of us, we didn't have a choice in it. And so now we're stuck working under conditions that we don't maybe necessarily naturally align to, and this is creating a lot of stress. And if there's anything that we've learned at MindBeacon, what we encourage people in the context of mental health to access therapy is that people are different and that they have preferences, and we really have to consider the way that they're most comfortable interacting. And I think that holds true with remote working. And that's why when we developed Beacon, it wasn't not only to overcome some of the traditional barriers to care, but it was also really about realizing that if clients had ways that were more comfortable for them to work with their therapist, they would be more likely to access it. And so, what we're seeing now with COVID-19 is that employers are looking for more options for psychological services now, particularly at a time to make sure that their employees are staying mentally healthy during a time which is not comfortable for them.
Thank you, Claire. Nigel, I'm wondering if you have any thoughts on this topic?
Sure, I'll build a bit on Claire's points. I do think, to Claire's point, that even before COVID-19, we were coming to terms with, and I don't know if I love the word policies, but figuring out how to best support our people in working from home and being productive. I would say some of the normal rules for team leaders and people leaders would still apply throughout COVID-19 to think about increasing the frequency of your team meetings. Maybe remind your managers of some of the basic rules around holding virtual meetings. So I'd say if you're leading meetings with global teams or geographically diverse teams, be sure to get input from the introverts on the phone, be sure to engage people for whom the meeting's not being held in their primary language. So those are just little tips to help people stay connected. I definitely use video conference wherever possible. More than 50% of communication is nonverbal, and as a manager or a people leader, I'd actually allow some time in between calls, so that if someone comes across as not quite themselves, you can actually do a quick follow-up and just say, hey, are you doing okay? I think allowing time for that is important. I'd say recognizing throughout COVID-19 that people working from home might be juggling childcare or have competing conference calls with their partners. So just creating the right environment to be accommodating and be supportive. And lastly, I am an actuary by background. So while I did say increase the frequency of meetings, I would say you should shorten the duration of meetings. I think one of the biggest things we can do for leaders in this environment is help our people focus on where they need to prioritize and spend their time.
Okay. Thank you, Nigel. And Karen?
Yeah, they're all great points, and I don't have a lot to add. I would only say that during this time, the two things that are really important are reliable systems so that people can get their work done. I mean, we have to acknowledge that companies have implemented new systems to allow people to work remotely, and they haven't had a chance to get used to them or their training involved. And the second thing, and we're probably going to talk about culture a lot, but it really is pivoting our communication tools. Culture is why people choose companies, we know that. And part of this is figuring out how to take your culture that organizations have fostered for years and years and turn them on a dime into making sure communications are empathetic and focused on individuals.
Great, thank you, Karen. And lastly, Lori, do you have anything to add?
Yeah, I would just add, I think, very great points just in terms of regular communication. So something like a daily huddle, so a quick 10 or 15-minute touch base with team members first thing in the morning. We have found very valuable just to kick off the day and create that communication right out of the gates as you're beginning your work day. And then secondly, I guess I would just add to the importance of creating time and encouraging employees to give themselves some space from their workday. Get up, get moving, get outside and get a little bit of fresh air. Obviously, maintaining social distancing parameters, but going for a walk, just kind of removing yourself from the space that you've created to work from home these days. Often we find that people are actually working longer hours because they're not commuting, and really just encouraging them to kind of get up and move and take some of that personal time is key.
Thank you, everyone. So building on what you've all just said, how can mental health support tools be positioned to enhance the employee experience in this current climate? Lori, can we start with you?
Yeah, so I think, as we just talked about quite a bit, communication is really, really critical right now. And I think really finding the opportunities to regularly remind leaders in particular around the practices that we just discussed. So regular touch points, doing things like daily huddles, finding an opportunity to encourage, I think Nigel's point was great, more frequent but shorter team meetings so that we're really combating this common challenge that we're hearing around social isolation these days. Folks are certainly feeling as they're working from home, especially if you are an individual that really thrives on, that personal connection, it can feel quite isolating to be at home. So those regular check-ins are really key. And as business leaders too, I would also just encourage all of us to be thinking about the resources that we have available within our organization. In many organizations, there are a wide range of resources available from, EAP or EFAP programs, virtual care services, resource hubs that are available on the intranet, or potentially even doing a resource inventory from publicly available resources and providing reminders to employees that these resources are there and they should be leveraging those resources to support them during these times. So often what we hear is that employees actually aren't aware of all of the resources that are available to them. And I think, times like the time that we're in these days, it's really just important to be communicating and encouraging use of all of those important tools.
Thank you, Lori. Karen, do you have any thoughts on this topic?
Yeah, so I would say, Claire started it off really well by saying people are different, and we recognize that people have different needs. And I think I've been in the mental health space for 20 years, and, we were on a journey 20 years ago convincing people mental health was a problem. And I think, this pandemic has made us aware that everybody has anxiety, and your anxiety and your uncertainty is a byproduct of your personal situation. And I think it's the first time where we all acknowledge we need additional support. So I'm an advocate right now for, at Snapclarity, we're very much focused on resiliency, well-being, and building the strength of individuals. And tools that allow you and are positioned in that way are, I think, at the forefront right now of what people need. And the ability to really understand my personal disposition, what is my propensity to have anxiety or stress, and how do I understand that and translate that into coping tools, because we know right now people are supporting themselves. They could be supporting a spouse, children, elderly parents. There's never been a better time to ensure your organization has those resiliency and well-being tools, because we've shifted upstream from focusing on mental health as an intervention for clinical mental health issues to everybody can benefit right now, because we know there's a study that is being circulated that a byproduct of pandemics is isolation, confusion, and anger. And the output of pandemics can be long-term PTSD for people who have those feelings. So really getting those resiliency. You may have never had a mental health issue in your life, but you're feeling uncertain right now. And I think organizations helping people get access to those tools is extremely important.
Thank you, Karen. Nigel, do you have anything you'd like to add?
Yeah, just a couple of points. I really like the point Karen made about, and maybe I'll go a little deeper on this idea that different segments of a workforce need different levels of support. I think even before the pandemic, that's something we still grapple with, evolving as employers and maturing to that mindset. But building on Karen's point, I think mental health support, if you pick a topic like anxiety, it looks different for everyone. For one person, it might be a video on how to talk to their kids about COVID-19 or how to deal with being isolated from an elder parent. For another person, it might be having a couple telephonic sessions with a counselor to just have someone to talk to. And still others might need a more structured program to really help them with tools around resiliency and converting their thoughts and into feelings and behavior. I mean, if you asked me 2 weeks ago, was it possible that someone would feel guilty about not washing their hands or sanitizing their hands after touching a door handle? Probably not. But there are people that feel they might be endangering their families, and I think they need more pronounced help. So I will say to employers, it's important to try to meet people where they are, have a range of tools, and not assume that the same modality or solution is right for every person. I would also add that to really help set employees up for success, in addition to having this spectrum of tools, I think we need to ensure that we promote what's there, which is a point Karen made as well. I think to ensure that we remove barriers, whether that's from an access or technology perspective, whether that's from a cost perspective, whether that's from a process perspective, because we do want people to get the support they need. And certainly I would think that what we're seeing in this market now is that more and more people can benefit from more pronounced support, because we're in an unprecedented period.
Thank you so much, Nigel. And lastly, Claire, do you have anything you want to add to this question?
Mm-hmm. Yeah, no, I agree with everything, all the points that are being made, and particularly Karen's point that 20 years ago it was a very different, even 10 years ago it was a very different conversation, and I'm certainly heartened by the recognition that mental health in our society and in our organizations is as important as anything else in terms of having a fully functioning organization. And so, our work has been really focused on eliminating the barriers for that percentage of people that have diagnosable problems, but who so many have not been able to really access help. And that's where, we have been very focused on making evidence-based treatment more available in new ways. And I think when the pandemic started, it really caused us to challenge ourselves and say, how could we use the things that we had built as an organization through Beacon in order to deliver this evidence-based therapy? How can we use things like the digital platform and, frankly, our national team of mental health professionals, to really make a difference with what Canadians are going through. And, I will say that we are very proud and happy to share that next Monday, April 6th, along with our sponsors, Manulife and Green Shield, we'll be launching a new program, Stronger Minds by Beacon, available to all Canadians for free. And this program will allow Canadians access every day to new guidance, tips, and activities, and how to deal with the stresses that are constantly changing as a result of this pandemic. And we'll do it in fun ways, videos, quick reads, activities, and things like that. This will all come from a place of our team of clinical psychologists who will be able to draw on their experience. And it will allow individuals to express the concerns that are changing hour to hour and day to day as we all go through this new normal together. So, I think that's really, we don't know what's ahead. And so it really about providing mental health support is providing something that's responsive to a reality that we can almost not anticipate.
Thank you so much, Claire. I'd now like to home in on a more specific tool, and I'm thinking this question would be for Lori. Could you please share how virtual mental health platforms right now might be helping employees during this pandemic? Hello? Lori? Would anyone else?
Lori.
Oh.
Yeah.
Hi,
Lori there? There she is.
I'm here. Sorry about that. This is one of the challenges I'm sure we're all finding these days, is you put yourself on mute and, you may forget in the moment. So I am still here. So I think one of the most important things I wanted to just call out in terms of why virtual mental health is so key for us right now, back to the points that some of the fellow panelists were making earlier, it's incredibly important to recognize that we're all different, right? And I think it's becoming more and more apparent as we interact virtually. And you can sort of see different communication styles coming through, and people really dealing with different dynamics in their own home and in their personal lives that, are starting to come through as they're showing up and coming into, the work environment day to day, however unique that might be today. So I think one of the key things is, removing barriers to access to care and to support for individuals who perhaps are feeling things, from a mental health perspective that are unusual or unique for them in these particular circumstances. We want to ensure that we're removing stigma and then also lowering barriers to access to care, and virtual platforms and the virtual modality of accessing that support really inherently does do that, right? You can access great therapy and great support from the convenience of your own home. So it's, sort of mitigating that challenge of getting yourself connected and perhaps physically into an office with a practitioner. It's very safe and convenient and easy to access that care and support. And then also, I think it's really important to recognize today, in the times that we're in, we don't want individuals leaving their home, right? So being able to access very high quality care while still maintaining social distance, it has been really critical. So now more than ever, virtual platforms, virtual access to all types of healthcare has been critical. And in particular, given our focus today, as I said, getting that convenient and ready access to mental health supports through that virtual modality, really, really important for individuals. And I think what's also key, back to our points earlier, is that employers are really promoting and encouraging use in these days, right? And ensuring that employees do recognize the services that they have available to them, and they're reaching out and using them, even if it is really just to sort of talk through the feelings that they may be feeling, or to engage family members or children in a counseling session with them.
Thank you so much, Lori. Given that this is a relatively hot topic at the moment, I'm wondering if anyone else would like to weigh in.
Oh, hi, it's Nigel. I'd love to pick up on Lori's point. I agree with everything she said, and I thought it'd be helpful to share a bit of perspective on some of our products at Morneau Shepell. So 2 weeks ago, we were one of those providers of a virtual mental health platform. We're big believers in CBT and ICBT, so the idea of a program where you can work through a platform, work through structured modules supported by a therapist every step of the way. We launched a pandemic anxiety module to tackle some of the things we saw people dealing with, like uncertainty, social isolation, caring for family members, stress management. Anyway, we've now had 2 weeks of experience in the market, and it's being incredibly well received. I do think we're probably understating the portion of the workforce that can do with more structured support and care. And I think the appeal of digital platforms is that if they're done properly, they can actually bring the price point down. They can improve access without sacrificing some of the clinical efficacy. So certainly our experience has been it's very much in demand by people and their employers and their constituents, and we expect that to continue. I actually think this will accelerate what the new normal becomes, even long after the pandemic. I think virtual platforms and digital care will become foundational. I don't think any of us are going to be in a rush to sit in a waiting room where someone has the flu or is coughing or sneezing. I think we'll really start to gravitate more and more to digital tools.
Thank you, Nigel. And then moving to new work and social environments posed by the coronavirus, Karen, I'm wondering if you could please articulate maybe some of the phases that people might be experiencing as they adapt, and how employers can support their employees who are now working differently than usual. So, for example, people who are now working from home as opposed to an office environment because of mandated isolation policies.
Sure, thanks for that question. So let me start by saying the phase that we all go through when these things happen is a storming phase. And that storming phase can be, confusion over how I'm going to do my work, or systems, or there's anxiety around the workplace coupled with anxiety around home. Somebody mentioned at the beginning of the call, two spouses can be working at home. Who's going to work in the office? Who's going to work in the kitchen? Who's going to manage the kids? So we have a storming phase where everything feels chaotic. And I think there isn't a person, whether that has experienced it, that hasn't had a bit of that. Then we go through the forming stage, which is we get our routines and we get down pat how we're going to do something, like be on a webinar and make sure the house is quiet and people aren't running through the office while we're doing a webinar. We start to get some normalities and expectations around how we can be at home. And then we get to the norming stage, where I think it's going to be very difficult for people when we come out the other side of this. We're going to say, I like working at home. I don't really want to go back and work in a workplace. So these phases, and people can move back and forth in the phases as they go through it, are really important, because the tools then that people can access to understand how those feelings, are they normal feelings? Should I be feeling very upset, or should I be, is this something that is normal for me? Having the ability to access assessment tools that can help you understand that and get the right coping behaviors is critical at this time. And I will tell you, one of the things that we have found, because I really like Nigel's framing that he did a bit ago around the pandemic module, is having access to those types of tools. And, you know, in our platform, we've had 19,000 people in the last 2 weeks go through an assessment that allows them to understand their resiliency factors and then get access to tools. And these would be people probably who didn't feel like they had mental health issues.
Right. And expanding on that, Karen, would you say that there's a difference between support for those who are working from home versus those who have been temporarily laid off?
So yes. So thank you. That's actually a really important question right now, as we woke up this morning and saw another large organization have to lay off a lot of people. So first of all, I want to say that Glassdoor released a study that said 75% of employers, they know that employees pay attention to culture, and it's an important decision-making in whether they stay with a company. 56% said culture was more important than salary. So the reason why I'm bringing up culture is a strong culture has an ability to support those who are at work, those who are off work, and those who are laid off. And we are in unprecedented times where companies need to stand up, and that culture that they build to attract these employees is now seen in the empathetic way, you know, being able to show empathy, be human, have communications that reach out to these people, because somebody is laid off is thinking about the financial implications this is going to have on their family today, next year, people going back to university, can I afford it? When am I going to get a job back? Those people who are at home, they have different anxieties, but they're very real to them. And this is a time where I would say CEOs, Chief Human Resources Officers, and companies like the panelists today, our job is to partner together and help you speak to those people and provide the right tools where they're at, both from their journey within the employer's current state and also the future. Because pandemics do have the ability to change the way we do business. And there's lots of businesses that were born out of SARS and 9/11, and we learn from these situations. And the only way to get through this is employers have to understand those who are laid off and those who are at work and start to embrace them and help them. Or we're going to see PTSD at levels that are not going to allow our economy to get back to the way we need it to function when we're on the other side of this. And that's my biggest fear, is the enablement of people to come out of this and be able to get back to supporting their families in a way that may be different than we have experienced traditionally. So I don't know, did that answer your question, Cassandra?
Yes, it did. Thank you so much, Karen. That was a very poignant answer. Much appreciated. So as stated earlier, mental health was already increasing in importance as an issue for plan sponsors prior to the pandemic. And I'm wondering if, Claire, if you could touch on what you're seeing in people's mental health currently that's heightened or diverse as a result of this crisis, and in your recent conversations with plan sponsors, what's changed when it comes to their perspective on workplace mental health?
Mm-hmm. Well, I think as we touched on earlier, the whole conversation has changed over the last years around mental health quite rapidly. And I think there was a time that we can remember when organizations would say that they were fortunate that they didn't have a mental health problem with their employees, that it wasn't an issue for them. And I think as time has gone by, that has become abundantly clear as they've looked at drug spends and disability costs and where those are drawing from. So most organizations are focused on mental health because of the huge literal costs and also social costs that there is within their organization. And that means that, you know, our conversation with employers has been really around that 20% of their workforce who is struggling with diagnosable problems, and how to get those people to access the help that they need and that they would benefit as early as possible. And, you know, so as leaders in guided ICBT, you know, that was what our effort was to offer new ways of encouraging employees to get the help they need. But, you know, what's different now, what's changed in the last month is the reality is, and all organizations are recognizing that all of us are struggling with our new normal. None of us are unaffected. and we are reacting differently from each other to different things, and that's changing day by day. And that is the reality that, organizations are facing. It's now not a niche issue, it's now a broad issue, just as Karen was saying, that we all need to get through this together, mentally healthy and mentally resilient in order to be able to continue on. And that's why we think anything that employers can do to allow their people to access real-time guidance on the topics that matter to them is so incredibly important, because this will change really rapidly. Our concerns will change, and we'll be concerned about different things. For sure, we will all be concerned about different things. We need to recognize that. And I think we need a place where Canadians that can go and they can get the support, but they also feel that it's a place that's responsive to their concerns that they're expressing, and that the guidance that they're getting is supported by professionals who have the experience and the expertise to speak broadly and widely to a whole host of topics. And I think people have brought up a list of the really broad things. I mean, whether you're a parent and you're trying to understand how to talk about the situation, whether with your children, whether you're in a relationship with a spouse and all of a sudden you're in closed quarters, how do you make sure that you don't that relationship isn't being negatively impacted by this situation, whether or not you are finding that a natural tendency towards having, feelings of health anxiety is not made worse by this situation. So there is a lot going on, and everybody will be reacting to it very differently, and organizations are going to have to jump on that. I think Beacon was designed and is available as a evidence-based therapy approach guided by trained professionals. It's one option for people to choose. For us, we're really excited about Stronger Minds and the program, because it's another way of accessing the support. And we hope that we're providing a continuum, which is really what we should be looking at for supporting mental health, a continuum of offerings that allow people to access what's truly right for them.
Thank you so much for your insight, Claire. My next question is for Nigel. How do you think plan sponsors should tackle workplace mental health in the midst of this new norm? What other aspects of an individual's life should plan sponsors keep in mind as part of their support?
Yeah, it's a great question, and there's a fair bit to unpack there. I'll start with, I wanted to acknowledge, for most of the attendees today, you're probably dealing with a multitude of organizational or business issues, everything from new work from home workforce, remote workforce, to thinking about business continuity. And what we're seeing in the market is, now we're starting to turn our attention to mental health and balancing mental health and physical health. So a couple of perspectives. The question was, how should we tackle workplace mental health in the midst of the new norm? So I'd start with the word workplace before we get into the mental health aspect. It's been said a few times, but I think it's worth repeating that what we're going through now, and none of us know how long it'll last and how we'll emerge at the end of it. But make no mistake, I think this will change how work is done, how we think of the workplace forever. I think we can no longer, as employers, have unclear work from home policies or remote technology issues. I think there'll be an expectation that working remotely can become more of a new norm versus something that's seen as a privilege. I think we think through how we measure performance. I think we'll rethink things like having employees come to work when they're sick, even if it's just a cold, large conferences, business travel. So all of that to say, if you first start to anchor by saying, well, I think the workplace will change, then certainly how we deliver mental health in the workplace will change. I think in the here and now, employers have a chance to step up and help protect their employees both with their physical health and ensuring the right measures are in place in terms of physical distancing, et cetera, as well as rethinking mental health support to address mental health well-being. I'd say that before the pandemic, and I've mentioned this before, I think many employers were still coming to terms with the fact that different segments of the population or their workforce need different levels of care. Some can do with relatively inexpensive care and things like digital mindfulness and digital skill building, whereas others require more support. And kind of leaning on my actuarial math background, I mean, the math is pretty straightforward, right? We know that somewhere between 1 in 4, some studies will say 1 in 5 or 1 in 3 Canadians will experience a mental health problem that'll impact their workplace productivity and impact business outcomes, and that very few of them seek support. And we can look at that if you look at utilization rates for most EAP providers, for example. So anyway, all that to say, the end result is what you see is a lot of like presenteeism, lost productivity, turnover, increased incidence and duration of disability. So it exists in our workplace today. Our workplaces are going to have to evolve. But here's the silver lining. I think all of this gives us a chance as employers to rethink our approach on how to best support employees, to remove barriers, to ensure they need the help they receive the help they need when they need it, and to really leverage technology in more thoughtful ways to make digital tools and virtual care more accessible and more affordable, and really a foundational part of the new normal. Lastly, you asked about, just to wrap up, you asked about what about other aspects of a person's total well-being should we be thinking about? Certainly, because what we're seeing in the markets, I think we should revisit financial planning and financial support around that. And I think we're seeing the importance of the family unit. And certainly I would look at extending healthcare and extending support, not just to members, but their family members.
Great. And Nigel, what lessons has Morneau Shepell learned from previous traumatic events that would apply to what's happening today?
I think there's quite a few, but I think the number one takeaway for participants listening on the call, as I would say, is keep in mind that traumatic events such as a pandemic have very long-lasting effects with respect to mental health that present themselves well after the crisis has passed. So, anyone thinking this is just an unfortunate blip on the roadway, I think you'll find that we really need to rethink mental health support. So that's one message. I'd also say that you need to communicate to your people that they shouldn't feel bad about reaching out for support. I mean, certainly in Morneau Shepell, we have a strong network of trained therapists. We have lots of experience dealing with the psychological impact of traumatic events such as SARS or natural disasters or terrorism or aggression. And, some quick tips I would say that I touched on earlier in terms of helping to focus. I think we want to help our people stick to facts that's communicated by public health agencies or medical professionals, whether it's the World Health Organization or the Government of Canada. Try to help them keep the situation in perspective, follow all the prevention tips we've all heard about. Washing your hands properly is probably the most single effective way. So physical distancing is one of the most effective ways to reduce the spread. And, germane to this topic, help people to practice stress and anxiety management. So whether that's getting enough sleep, having a balanced diet, hydration, exercise, talking about your fears, meditation, help people to find the self-care practice that works for them and to, as I said earlier, meet them where they are. But that would be the lessons we've learned from previous traumatic events, that people need guidance, need support, and that the effects from a mental health perspective continue long after the crisis.
Great. Thank you so much, Nigel. I'm now thinking about evaluation and how plan sponsors can be certain that a workplace mental health solution is truly having a positive impact on employees' overall resilience through this crisis. Claire, you mentioned resilience earlier on in the webinar. Could you please weigh in on this?
Mm-hmm. Well, I think what occurs to me as I listen to all that's being discussed in this panel is that, it's important for us to understand that even though this pandemic is, I think, being felt as a crisis and as something totally different than we've ever experienced before, it's also really important for us to ensure that we're showing some discipline. And whether it's on a personal basis, when we talk about, making sure that you approach your day with some discipline and getting up in the morning and having a shower, or making sure that you have exercise as part of your day. I also think for organizations, who I love to hear wanting to help and solve the problem, but to not forget the discipline of how they should look for solutions. And I think that, you know, as an organization, we have always been very focused on a very, you know, outcomes-based, evidence-based approach to what we do in mental health, no matter where we're doing it, but being very focused on outcomes and being data-driven. And I think that we feel good about the fact that, you know, we've shifted some of the conversations that organizations are having, that we're having with our partners, you know, away from sort of a simplistic how many people use the program to getting into a more sophisticated evaluation of the impact of the program. And so what I would say is, you know, I would stress to not lose the discipline that we all need to have as part of our go forward in these times, and to look for programs and partnerships where there is a transparency and a willingness to share aggregate results of programs so that you can make the right business decisions to support your employees through these times. You know, and the other thing I perhaps would also call on is that, you know, that's the quantitative side. I think the other side of it is that we've said again, we are all individuals, and we will all react to this situation differently. And it's really important to look for programs and supports that really facilitate personalized care. And at the end of the day, you know, that one-on-one in-person visit in a clinic, which is the traditional way of accessing, is not an option. And so there are other things that can be done virtually, but I think we really need to look for programs that speak to the individual and what their individual needs are. And I guess, you know, that's what I would say.
Thank you so much, Claire. And my next question is for Lori. What employee healthcare demands are you seeing in light of the coronavirus, and can benefits plans keep up with the present business environment?
Yeah, thanks, Cassandra. I think maybe before I jump into that question, I just want to just speak to the point about, you know, how we're all sort of showing up in this particular circumstance. So one thing I just want to take a moment to encourage us all to do is to really be a bit more vulnerable and a bit more sort of open to, you know, bringing the human, let's say, in us to work, and being more real about the fact that we are all in this circumstance and this situation together. And so, you know, let's say prior to March of 2020, you know, we're perhaps hiding what's happening in the background when we're working at home, right? And ensuring that we don't have our four-legged friends or other family members coming into the screen if we're on a video call. I think we're in an instance at this moment where we are all in a highly unique situation. And one of the things that, you know, we're certainly finding that is helping us all to get through these times is to be real about the situation that we're all in together. So share stories about what's happening as we try and adjust to this new normal, you know, share some of the humor in our work days and some of the humor that we're finding, you know, as we find new ways of connecting with family and friends. You know, and I think that is really, maybe without overtly stating it, one of the demands that's existing within workplaces, our new norm workplaces today, is to, you know, to really be transparent and real about what's happening and the fact that, you know, we're all having this experience together. So in terms of, I just want to talk a little bit about what's happening in our business. And I think it goes back to, you know, the fact that there's a lot of unique circumstances within different businesses. So certainly many of our clients are going through instances where they're having to cut back their workforce, potentially looking at layoffs, and that's creating a lot of stress within the work environment. We are finding ourselves in the unique position of having a product and service that is in incredibly high demand in this moment. So what we're doing really is supporting employees who are now working to a large extent 7 days a week to try and keep up with the demand, whether that's our clinicians supporting high volume, our sales folks, trying to support interest and demand from the market. So just for some perspective, our business has grown 3 times in the last 3 to 4 weeks. So it's a very significant amount of scaling and growth in a very short period of time. And that's creating an enormous amount of stress on our team, but it's a very different type of stress than we're seeing, within, many of our family and friend networks or perhaps with some of our clients. So again, being cognizant that we are all different and we are all experiencing different kinds of stress, I think is also key in how we show up at work and how we show up for one another. In terms of how COVID is impacting our business, and I think this speaks to the demands that we're seeing amongst clients and sort of the workforce in general. So we provide virtual care services that are for all aspects of health. So we certainly support mental health. We support many chronic conditions with our virtual care services and platform. Today, we are seeing 40% of the volume in terms of patient appointments and questions coming in are COVID related. 60% are non-COVID related. And within those non-COVID related appointments and inquiries, there's been a significant increase in the number of mental health related appointments and risk factors and conditions that we're supporting. So again, I think it's just, it's incredibly important to recognize, that's about half of our business right now that has been really scaling up very quickly to support things like assessment tools, understanding symptoms, and then providing accurate provincial resources and guidance around, how to deal with symptoms, how to be properly assessed and tested. So it is a day-to-day transition that we're seeing. And then I think just back to your point, Cassandra, about whether or not benefit plans will be able to keep up with this business environment. I think to Karen's point earlier, we are seeing a new normal today. I expect that, as we come out of our current situation, our way of working and our, the resource requirements are definitely shifting as well. And so one of the things that we've seen that I think is incredibly positive is this really escalated adoption of virtual platforms to access healthcare. Many benefit plans and providers are now, for example, using virtual platforms to make access to paramedical services that wouldn't previously have leveraged virtual platforms. So things like, dentistry, physiotherapy, now using virtual care as a modality to deliver because it's an absolute need in the moment. I think we're going to see more of that continuing. And I think, from my perspective, certainly it's definitely a positive. It does really eliminate barriers to access and allow us to provide new ways, new innovative ways of delivering care. And I do think that providers will shift to ensure that we can continue to support that demand. So I think it's very positive. We're all being, sort of forced in the moment to become more innovative and to jump forward in how we work each day, but also how we provide service. And I think ultimately that will serve us well as we come out of this current state and then continue to leverage those great resources to provide access to care.
Thank you so much, Lori. And to conclude, I have one last question, and let's try and keep our answers quite brief as we want to leave time for some audience Q&A after. But let's talk about some innovative practices employers are mobilizing during the coronavirus pandemic. Karen, could you please share some of these?
Sure. So I've been very fortunate to be spending the last couple of weeks doing consults with companies who are just asking, how can we help support people? So we're, Estelle Morrison and myself, we are doing those consults, and here's what we've heard. Number one is coming back to the culture. People go to work and work in an environment where there's trust, they can share knowledge, and they find new ways to perhaps do work styles. So one of the things I think is critically important right now is creating that communication plan that allows you to figure out how to engage. The second thing is that we're seeing is there's a lot of collaboration tools that are being deployed right now. Some are free for small, especially small businesses that are struggling right now to figure out how to do it. There's collaboration tools. There's virtual whiteboards where people can post ideas. Somebody mentioned it earlier, the team huddles. There's a lot of creativity going on. I think the most important thing is about being human first, though. So people are finding ways where CEOs are recording messages and emailing them out, or chief human resources officers are doing the same thing. Lastly, I would say that there is a lot of virtual care platforms out there. We know that Google, 1 billion people every day Google health-related issues. And of that, those Google, 7% of the searches are all health-related, getting advice on how to deal with specific health issues. The number one thing I can't overemphasize enough is employers need to vet and make sure they're credible sources, they know where the information's coming from, and that there is both an assessment component and a catch component to this, meaning we are still dealing with people who have clinical issues, severe clinical issues, and we need to make sure that there are the right therapy solutions. Claire talked a lot about that on the other end. I agree with her wholeheartedly. Now is the best time for people to understand that therapy is a good solution for clinical issues and that can be accessed anytime, any place. And I'll conclude with one last comment. We haven't stopped learning. HR collaborators need to find ways to share best practices. Now is the time for, if something's working, we need to find venues to share these best practices so that we can learn from each other, because nobody wrote a book on a pandemic and how we can support employees. We can only learn from each other.
Thank you so much, Karen. And very briefly, Nigel, would you like to share some of the innovative practices that Morneau Shepell is implementing at this unprecedented time?
Yeah, I know I'm standing between questions and the panelists, so I maybe rather than the innovative practices, because I think Karen's covered a lot, and I don't want to pile on, I would say that I think having events like the one that Benefits Canada has done today has been fantastic. It's been a pleasure to present with our fellow presenters, and many of us are competitors in the normal course of action. But I think what we're going through now, it's just important that we leverage our respective strengths and capacity to help as many Canadians as possible and to help as many people as possible. So that would probably be my closing comment. I think we're greater together, and that's probably the best way to lead to more innovative practices and to support our people.
Thank you so much.
And it's Claire. Claire, I'd just like to add, I agree with you, Nigel, and I think there is such a huge need, and it does require collaboration for us to be able to even begin to address that need.
Thank you, Claire. And thank you, everyone, for your insightful commentary and advice. I'd now like to open up the remaining time we have to address some questions from our live audience. And we got so many questions, unfortunately, we don't have enough time to answer them, but stay tuned for the coverage of this webinar. So our first question will be for Claire. And the question reads, we are all different, but what could some cues be for a leader on a video or conference chat to identify if a team member is struggling with mental health related to isolation or working from home?
Mm-hmm. I think it's really about keeping the lines of communication open. I think that many organizations have done training to help managers and peers identify those amongst them that might be struggling, and I think the chances are that the occasions of this are going to only increase. So, we use a particular in our organization. I don't know if I'm supposed to call it out, but I was not a user of this conferencing system in the past. But I really encourage when we get on during the day to make sure that people put their cameras on, and so that we have a chance to actually not just listen to each other, but look at each other and I think that these are tools that we all have at our disposal at times like this, and we should be using. We should use the training that we have had in the workplace and modify it for our current reality.
Thank you so much, Claire. Our next question is for Nigel. Are there any tools you can recommend for those working from home with family members whose mental health has been triggered by the uncertainty of what's going on right now? How can we support them? And are there resources we can utilize to provide a safe environment for ourselves as well as them?
So thanks for the question, Cassandra. Firstly, I wanted to just quickly touch on, I'm half kidding, but to touch on Claire's answer and the tips that leaders are looking for. And I'd say the number one thing is to look for changes in someone's normal behavior, right? I think if you're an extrovert, it's pretty difficult now being isolated. And I half kid with my teams as a deep introvert that I was born for social isolation. But I think anything you can do to notice changes in behaviors will go a long way to see if someone can do with a bit more help. Specifically in terms of tools, certainly we're one of the leaders, and I'm a big fan of ICBT, so therapist-driven, and the reason for that is I like the structure of it in these abnormal times. And what we're hearing from a lot of people is just being able to carve time out in your day, maybe after you put the kids to bed, to have access to a therapist, to have some homework to do, to keep you focused and build resiliency skills. I think there's a great demand for that, and I think a lot of people in this environment will benefit from that sort of structured clinical approach.
Thank you, Nigel. And our last question of the day is also for you. And the question reads, I understand how the need for virtual care has increased, but the budget for such a benefit is lower than ever. How would you suggest an employer justify the cost when employees are being laid off and employers are looking to save money? Nigel?
I think it came up earlier. So hey, listen, there's a business reality, and every organization is different. So I can't speak to that. I will say that I think it was touched on earlier. There's some simple things like if you look at your allocated budget for paramedical spend, I mean that's probably down quite a bit because chances are not a lot of people are utilizing face-to-face practitioners. So that's probably one source, and I'd say the other source would be to think about. I do think this has kind of brought things to a head about, how we tackle mental health as a business issue, not necessarily an HR issue. So I think there are, whether it's in the benefits program or some other training budgets, I think there are ways to look at directing care to where it's needed most and reprioritizing. So, have that trusted advisor walk through that with you. But some of my quick thoughts would be to rethink your paramedical budget, rethink your training budget, and balance that against what you're seeing in terms of business continuity and the business reality of layoffs, et cetera.
Thank you so much, Nigel. Unfortunately, that's all the time we have for questions. Thank you all for such an informative discussion. I'd like to thank our panelists, one more, Claire Duboc, Nigel Branker, Karen Adams, and Lori Casselman for sharing their morning with us today. And thank you to everyone for tuning in. When you exit today's webinar, you'll be prompted to answer a survey. We'd appreciate if you took the time to provide your honest feedback, as this is integral to the planning of future webcasts. Have a lovely afternoon, everyone. Please stay safe and look after yourselves and your loved ones.